Today I have Dr. Lesley Samulak, a pelvic floor therapist, and together we're going to discuss how inflammation and degeneration affects the pelvic floor. So Dr. Lesley, how did you get involved with this?
Well, thank you for having me. So I became specialized in pelvic floor therapy after I had my children. I'm a mom of 3, and back in the day, I'm older than I may appear, there wasn't a lot of guidance of pelvic floor therapy and rehab after having children. When I was younger, I was quite athletic and active, so in my mind I thought pregnancy and postpartum recovery was going to be easy, when in fact pregnancy was quite challenging for me. I went through a lot of pain, I gained a lot of weight, specifically with my first child.
Okay.
And then postpartum recovery was even more difficult for me. My body did not bounce back. I was not able to re-engage in activities that I wanted to, such as running and working out and playing sports recreationally. And then after my third child is when I really started to feel impacts on my pelvic floor. And there wasn't a lot of guidance. I thought that I was the only one, where was I going to find help? Nobody knew. Then you hear that women just have these issues for the rest of their life. You think about when you talk to your mom about it, leakage is normal, or laxity of the pelvic floor is normal for having babies, when in fact it is not normal. It might be typical for a lot of people, but it's not normal, and it's not how you should feel the rest of your life. And so once I started doing some more research, I found the world of pelvic floor therapy, and I got a little more guidance, and I was able to work through the symptoms that I was feeling, and I got better. And I was like, why don't more women know about this?
Right.
Why aren't we referred to pelvic floor therapists after having babies, or even before we're having babies? Maybe in preparation of babies, just so that we knew what to expect and how to prepare and what to do if we come into issues. And so that's really, I was like, all in. Let's help as many women as possible so that they can feel like themselves again.
It's something I never actually even thought about. What you just said it goes back to preparation that you're saying too. It's not let's do this afterwards. There are things you can be doing to prepare for it.
Absolutely.
To kind of help your body.
Absolutely.
That's brilliant.
Yeah, and in different stages of your life, you're going to be wanting to work on different things. It's not always the same. For instance, when we think of the pelvic floor and pelvic floor dysfunction, so we're thinking of like bladder and bowel and sexual dysfunction.
Okay.
It's not all about tightening the pelvic floor and making it really strong, and then I think a lot of people misunderstand that, and so when they see these social media videos and all these influencers are telling you to tighten the pelvic floor to get rid of these issues, this in turn actually can make symptoms worse and lead to chronic pelvic pain. So that's another reason why I'm really passionate about educating women about these issues, is because we see other people doing things and we think it's right for us, but really you need to be evaluated by somebody that's educated in this area to find the best plan of care for you.
I'm curious too. I certainly know women. Are men ever needing this type of therapy?
That is a great question. Yes, men also would benefit from pelvic floor therapy. I personally don't treat men, but that's just my personal choice. Yes, men have very similar structure in their pelvic floor in sense of muscles, and they go through the same symptoms as women. So yes, they are definitely valuable in seeking pelvic floor therapy if needed.
So Dr. Lesley, how does inflammation and degeneration affect your population of patients?
Inflammation affects the central nervous system. So we help patients a lot with central nervous system dysfunction. For instance, on one branch of the central nervous system, we have the somatic nervous system. So these are our voluntary controlled movement patterns. So that includes skeletal muscle. Okay? So when we have dysfunction of the skeletal muscle, that can show up in the form of increased muscle tension, dysfunction in range of motion. We can have weakness, we can have coordination issues. So if you think of skeletal muscle in the body, that's the same for the pelvic floor muscles. We can have issues there. So that's what we work on with individuals to help improve their symptoms. And even though I say I'm a pelvic floor therapist, we don't only focus on the pelvic floor. It's the whole body that supports the alignment of the pelvis. So anything that brings that pelvis out of alignment, we're going to go ahead and assess. We're going to figure out what's going on, and then we're going to treat that to help balance the pelvic floor muscles out with better pelvic stability.
So in a treatment, I mean, well, first of all, how long do treatments last? And I'm assuming it depends on everybody as to regards to duration of treatment and...
Yeah. So typically with my practice, we take a 60-minute evaluation. So a lot of that's going to be subjective questioning. You know, we really want to learn more about you, what's important to you, what's been symptomatic for you, where you want to be, where you're at today. Then we're going to go ahead and assess your pelvic floor if that's comfortable for you. If that's not comfortable for you, there's other ways that we can look at the body to figure out what may be contributing to your pelvic floor.
And for somebody like me, what does that even mean? Like, how are you evaluating?
Yeah, that's a great question as well. So I'm going to look at your posture. I'm going to look at your breathing mechanics. I'm going to ask you what you do in a typical day to analyze your movement patterns. And then I will also assess your pelvic floor, again, if you are ready. That's not with a speculum like at the gynecologist. You know, I use my hand and I can determine, do you have coordination of your pelvic floor muscles? Is there range of motion? Do you have muscle tension? Do you have strength? Do you have weakness? All of the things that we need for muscles to do, just like any other muscle in the body. Yeah.
Okay, and then I'm assuming in the office after you do this evaluation, what does the actual treatment look like?
So after the evaluation and we figure out what's going on with your body, we'll have a better idea of what kind of treatment plan is best for you, and that will be discussed. For instance, if I have more chronic pain patients, I will have a longer plan of care for them because they're going to need to see me more often and over a longer period of time. Someone that has more of an issue with some of the strength and coordination, we may have a shorter plan of care. It really just depends on what's going on and your goals and then what's comfortable for you. I know realistically some people can't come in and see me every week, and that's fine. You know, as long as we're getting you to achieve your goals, we're going to work with you in any way we can.
So I know a lot of people are familiar with Kegel exercises, but what other types of things, is that even part, I mean, what types of therapies or what types of home care are people doing?
So Kegels can play a part in pelvic floor therapy. Traditionally, the older school of thinking was all pelvic floor dysfunction should be addressed with Kegel, and if we think of Kegel, we think of tightening the pelvic floor all the time. As we continue to get more research in the world of pelvic floor therapy, we see really it's more of a holistic whole body approach, and what are we doing to address everything else that supports pelvic alignment. So that can be anything from your lower extremity, upper extremity. Again, I'm very focused on those movement patterns. Right. If you think about, again, your daily life, we are in similar movement patterns each and every day, and that can create muscle dysfunction because we're not using it as frequently as we'd like to build muscle in certain areas, and the body works on efficiency. It's not going to just magically start working muscles that have a little weakness. It's always going to trend towards what is easiest and efficient for the body, and that's where we can lead into chronic pain patients.
So I guess I have a question because it's something I actually never really thought of. When you're in a room with a patient, depending on how they're presenting, are you also then working accessory muscles? Are you getting in there and working all these attachments, or what does that look like?
Yeah, so our plan of care can look like exercises.
Okay.
Again, anything to do with coordination, range of motion, strength, endurance. And then on the flip side, we do use manual therapy treatment where we need to work on muscle tension and getting that to relax. Anything that we can do, we have a wide variety of tools in our toolbox, and we're going to go ahead and use them. But speaking again into inflammation in the body, we also treat the other branch of the central nervous system. So on the other side, we have the parasympathetic, the rest and digest. We work a lot with the sympathetic nervous system. That's the fight, flight, or freeze stage, right? So we get a lot of dysfunction of the pelvic floor when we have the sympathetic nervous system dominance over the parasympathetic. And we, as pelvic floor therapists, really need to make sure that those systems are working hand in hand because they relate specifically to bladder, bowel, and sexual dysfunction, constipation, urinary frequency, pelvic pain. All of those stem from that side of the branch as well. So we want to make sure that we are what we call down training the sympathetic nervous system, so we do have improved function of the pelvic floor.
Wow, so you're potentially down-regulating things. I've never thought of it like that.
Yeah. And some people can also be more parasympathetic dominant as well, and we're going to run into issues that. But, we do use manual therapy strategies to help down train. We do use other things like mindfulness, exercise, encouraging sleep, making sure people are sleeping well. Although we are not nutritionists, we do discuss diet because as you know, that contributes to inflammation in the body as well.
That's interesting because that's something I do with patients often. You will give them suggestions, potentially supplements up or down regulate those portions of the nervous system. Fascinating. So being a pelvic floor therapist, does that mean you're a physical therapist?
So that is a wonderful question. I do get that a lot. I'm actually an occupational therapist. I have my doctorate in occupational therapy. In the world of pelvic floor therapy, you can be either a pelvic floor therapist or an occupational therapist. My profession isn't as represented as well as physical therapists, but we do have the background to make us more than specialized and accredited in this profession. Pelvic floor therapy is a post-professional specialty as well. So once you get through physical therapy or occupational therapy school, if you want to specialize in pelvic floor therapy, you do it afterwards. And so a lot of the courses that specialize you in pelvic floor therapy are open to various professions. I mean, these include occupational therapists, physical therapists, there's midwives that can join some of these. I think some of them can be nurses. So it's not an exclusive area, but there are certain professions like physical therapy and occupational therapy that are more geared to pelvic floor therapy and have the recognition in that area. Don't be deterred by whether someone is a physical therapist or occupational therapist. Most importantly, just like any profession, you want to find the provider that is best suited to you, is going to listen to you, really going to give you that individualized plan of care and help you get better.
It's interesting. It's not a discipline that I see a lot of, really.
Yeah. I think we are undervalued in what we can bring to the table. Our profession just has such a wide variety of conditions that we can help that it's hard to define us to one specific area, and so that creates a misunderstanding of what we do. And so hopefully things are starting to change in the world of healthcare. I do think that honestly, for us to evolve and bring value to patients all over, we need to start being more collaborative and really just focusing on how we can bring a holistic value to patients and not worry about, well, you're this and can only stay in your lane and you can only treat this. Like, really, we just need to work together.
I agree. All right, so what role do you feel that diet inflammation play in managing pelvic floor?
So diet's really important. We know that foods can be triggers for inflammation in the body. If that happens, then we're running into bowel issues, bladder issues, things like constipation, fecal incontinence, overactive bladder due to triggers from their diet. We have patients log food if needed so that we can identify triggers and try to eliminate possibilities that might be making inflammation in the body worse. At some point, though, we do refer out. Again, that's not something that I'm specifically trained in, but we understand the basics of it and how it contributes to the pelvic floor. And again, lifestyle. We want to make sure that people are managing their lives in a way that's healthy for themselves. We have a lot of stress in our lives, and it's really helpful for us to discuss that with our patients and try to de-stress them, give them strategies like daily exercise, sometimes meditation if that's something that they agree with. Sometimes it can look like journaling. I'm more of like the progressive muscle relaxation meditations that we can really identify where we're holding tension in the body to help de-stress us and in the end reduce inflammation.
That just really excites me because really before talking to you, I'm thinking pelvic floor therapist, let's do some exercises, let's just evaluate, but you really truly are looking at it from a holistic viewpoint, encompassing a whole bunch of different things. That's exciting.
Yeah, absolutely. I think that maybe that's where some of pelvic floor therapy can look like it's not beneficial for people because they feel like, well, I don't want to just address my pelvic floor. What's that going to get me long term? And right, maybe it won't get you very far long term. And that's why we want to make sure that we're giving you those lifelong strategies so that you continue to see benefits,
And it would make me think too now that if somebody was looking for somebody for pelvic floor to really ask a bunch of questions, to see really where they're coming from. Are they really just in there giving some exercises and a couple techniques, or are they really looking at it from a holistic standpoint? To me, that makes a lot of sense.
Yeah, so you're right. We have a variety of patients at our facility. So we do have some patients that, you're right, they come in, they just want to be evaluated with their pelvic floor specifically. They just want to be giving exercises and go about their life, and that's completely fine. Let's help you there. But we do have the longer term patients that realize the value that we bring and they're feeling good about themselves, and we continue on that plan of care in addressing other issues in the body because they realize, oh wow, this is addressing more than just my pelvic floor. And a lot of the symptoms of pelvic floor dysfunction aren't just because of the pelvic floor.
Or even like things that I do in my practice too, like you see, you're talking about foods and triggers. A lot of people have an issue with dairy. Dairy can often cause constipation. Mm-hmm. If you're not fixing that, you're constantly going to have a problem down the line.
Exactly. Yeah, and those are the discussions we have with patients.
So when I think of pelvic floor, I certainly think of moms that have had children and just the complications postpartum. Who else are you seeing? Who else are your population of patients?
Yeah, so I treat from 18-year-olds all the way across the lifespan. So we see conditions of pelvic pain, constipation, urinary issues. I also do a decent population of individuals who've gone through trauma, and trauma is stored in the body with inflammation, and so we address those issues, and that can be when they're ready. Manual therapy techniques. Again, it can be, downtraining the sympathetic nervous system so that we can eventually work towards manual therapy if needed. And being an occupational therapist, we do have that mental health background embedded in our profession, so I can go ahead and use my tools to address some of those issues as well. So again, it's a holistic treatment. I do find that being able to use my mental health strategies that I have learned in my profession gets me to that better trust and safe place with these clients who've experienced trauma, so that in the end we can make better progress.
So what are some practical strategies that people can implement at home?
First and foremost, don't fall victim of following social media or influencers about what you should and should not do. Also, do not immediately think that your pelvic floor dysfunction is stemming from muscle weakness.
Okay.
A lot of times I see patients immediately grasping onto that, and so they are all in and strengthening, and they end up seeing me, and now we have increased muscle tension, loss of range of motion, and now we have to go ahead and backtrack. So things I always tell my patients, daily movement is important, and that's, yoga's great. I really encourage yoga, and that doesn't mean you need to go do an hour-long yoga class, in the convenience of what we have at our fingertips now. YouTube has some really great, 5-minute yoga videos. Just get your body movement. A lot of times, because our body's not moving, and we do get in those stagnant movement patterns, that's where we're running into further issues. So movement is key. Water. While I do encourage all fluids, because I do think that we do not drink enough fluids, again, we're going to backtrack, and some fluids are triggering to the bladder. For instance, things with caffeine or high acidity. So I do encourage water, but I understand that not everybody likes water. So fluids, but water is paramount. Sleep. We really need to focus on sleep. Our body can't handle daily stressors if it's not getting enough sleep. And I know that's hard. We're all busy and we're all go, but sleep should be priority.
Right, definitely. So if I have patients, which I really do get, that have issues with leakage, what should I tell them? What should I tell them to expect if they were to come to see somebody like you?
Yeah, so that's a great question. Tell them first, call me. I always start off with a conversation with my potential patients. We want to make sure that we work well together, that they're a good fit for me. From there, I'll go ahead and let them know that the first visit is an evaluation. At that point, I'm going to assess their body, whether that's just their postural stance. From there, maybe it'll lead me into whether or not we need to check out specific range of motion, strength, coordination of muscles. And then if they are agreeable and comfortable with me at that point, I will see if they are comfortable with a internal pelvic floor exam. Again, at that point, I use my hand. It's not a speculum. I want to make sure that my patients feel safe in the space. The worst thing they can do is be very uncomfortable and stressed out, because in turn, that's going to show up in their examination and give me false data. We'll also go ahead and discuss their lifestyle, dietary needs or restrictions. I do have quite a few patients that have learned through their life that certain foods are inflammatory, so we go ahead and review those. Bowel and bladder habits, anything I can learn more about your habits in your daily life, the more we can kind of break away some of the pieces and find out where the foundation is. Once we go through all that, I'll have a better idea of what I recommend for their plan of care. Again, it's not me specifically telling you this is how it's going to be and you're going to do it. It's really got to be collaborative. And I will suggest perhaps that you need X amount of sessions. And the frequency would be once a week, once every other week, once every 3 weeks. I really want to work with your schedule. Then I give you some homework to do at home, and that can look like exercises, behavioral modification, mindfulness, anything that I feel is going to address your symptoms and help alleviate what you're feeling. And then we progress it from there until we get you to a point that you feel great.
I have a question. Do you ever have situations where, I know as people are improving, I'm sure they don't need to be seen as much, and I know you're giving them things to do and exercises and such at the house. Do you have patients that are then more on a preventative care plan? And what I mean by that, do you ever then later on see people once a month, or depending if they need it 3 times a year? Do you have situations like that where you're continually following up with them?
I do. I always follow up with my patients. They always know, call me, and I will give them specific instructions. If you feel A, B, or C, call me. Let's
Right.
talk it out. I also have patients that get to a point where we have achieved their goals, but we still do, let's make an appointment, 2 to 3 months out. We're going to hold that appointment for you. At that time, if you feel like you need to come back, you have that spot. That is
Right.
for you. But if you don't, I'm going to make sure everything's okay, and we'll go from there. And then if they don't need me, wonderful. If they do and we want to work on other things, they come back. So, I'm always just here for them in any way they need, and, that's what's important, building those relationships.
Right. So do you see any emerging trends in your profession?
Yes, so trends can be great and beneficial, right, as we evolve in the healthcare professional world. Unfortunately, we can also see some trends that are not benefiting the client. For instance, in pelvic floor therapy, there's been a lot of what I call machines, where patients are hooked up to these machines that promise to strengthen the pelvic floor or get rid of incontinence. Unfortunately, a lot of times this is before the patient is assessed for pelvic floor dysfunction, and a lot of times they don't actually need the strengthening. A lot of these machines too don't actually address the pelvic floor muscles. They address the muscles surrounding the pelvis, for instance, like the glutes.
Right.
And so now we have increased tension in that area, so we're going to have issues in the future as a result of that. I do see a lot of patients come see me after they've had procedures done that were kind of sold to them without having the knowledge of actually what's going on with their body. So that is a trend that is emerging, and hopefully through conversations like this we
Right.
can inform people that, just because it's popular and it has all this great marketing behind it, it's not always the best choice for you.
I guess I'm just curious, what kind of procedures are people doing that potentially aren't really...
So there's a device out there that is a chair that women sit on to help get rid of pelvic floor issues, and it just vibrates and stimulates the pelvic floor.
Okay.
There's also machines that, things like Kegel weights and, stuff like that. While maybe the intention was there when the device was created, without an formal assessment of what's going on with your body, and this is outside of pelvic floor therapy, this is with anything.
Right.
You need to know whether or not that's actually bringing value to you.
So I know we've been talking about inflammation and degeneration regarding the pelvic floor. I'm curious what you know about stem cell therapy, because it's something that I'm extremely passionate about, and how that would impact your patient base.
Yeah, so I work with a lot of patients that I do think would benefit from stem cell. Pelvic floor dysfunction is not only for the young population. I also see quite a few older patients, menopausal, postmenopausal, probably the oldest patient I saw was probably around 95 years old. I also see patients with chronic pain injury, so anything that I can use to inform them of how to combat degeneration and inflammation in the body is going to help my practice be better at helping my patient as well.
So we're talking about inflammation that's impacting pelvic health. I'm just curious, what kind of symptoms and what are you seeing with your patient base?
So the initial symptoms for someone that would come see me that may have inflammation are bowel, bladder, sexual dysfunction, anything that affects the central nervous system. I know that we're going to have inflammation in the body affecting that, that's triggering these symptoms, so a kind of backward chaining. And then that's going to lead me into what strategy can I use at that point once we've kind of peeled back some of the layers of how do we address inflammation in the body even further. And so I see stem cell being really beneficial at that point for my patients to get that next layer to help resolve their symptoms.
Because I think you're saying too then, like earlier on when you're working with patients at first, though, you're looking at lifestyle, you're looking at diet.
Mm-hmm. Yeah, so anything I can use in my toolbox to address inflammation in the body. You know, I really talked about making sure we don't have sympathetic dominant.
Correct.
You know, I'm going to use my manual therapy strategies. I'm going to use yoga, movement, meditation, all of those things that I have available to me and that I have learned specific to my specialty. And then I like to be collaborative with other healthcare professionals because the body's a system and we need to treat it holistically.
Right.
And just treating one specific symptom is not going to resolve issues. We need to make sure that we're working together so we can address everything and so we can get our patients to actually feel better.
Right, and it's looking for the source. I love that.
Right.
It's not about treating, it's not chasing symptoms. It's
Right.
looking the source of the dysfunction.
Exactly.
So for me, I actually had 3 rotator cuff tears and a labrum tear in this right shoulder. And with my job, it was really impacting myself. I did a lot of therapies, from chiropractic to massage therapy to types of physical therapy and adhesion release. And I did get to about, I would say about 80% better, but still my life was impacted every day, especially when I was working with my patients. So I guess that's my question. Do you feel like that would be something then potentially with some of your patients that don't make it fully, that they benefit from stem cell therapy?
Absolutely. I do get a lot of older patients, particularly that I can see that are specifically related to injuries like yourself, where they've had, you know, chronic knee issues or they've had past hip replacements, and, you know, that affects pelvic floor dysfunction. And there's only so much I can do, but when we have that much trauma to the body, that next step of stem cell can really benefit and regenerate some tissue damage in the body, reduce inflammation. And so now when you take that away from the body, it can now focus on healing to the next step, right? So I do see great benefits of stem cell.
I was just going to say, I love your philosophy because you're even putting together, a lot of people are missing the boat on some things. What you said to me, what really excited me is that you see people with hip problems or even knee, like going down the kinetic chain further, and how somebody can have a problem with their ankle, their knee, their hip, and now can affect further up.
Absolutely. I think patients are really surprised because they come and see me for a pelvic floor dysfunction, and, you know, our questionnaire, have you had past injuries? And usually they leave it blank. I'm like, have you ever had a sprained ankle? Have you ever broken your wrist?
Right.
You know, anything like this is going to create what? Differences in their movement pattern. And, you know, when we have pain in the body, then eventually we try to avoid that area of the body. Then we're compensating in our body, and then we're having dysfunctional movement patterns. So again, this affects our postural alignment. This affects how our muscles work. So they're always interested when I, you know, address issues like this. Like, what does this have to do with what I'm experiencing?
True. Or even with your older patients, there's some people, like you said, you're doing these different things and they fully recover. One thing when I was really learning about stem cell a couple of years back, one of the questions I had was, you know, who are these patients? And the number one reason people are seeking stem cell therapy is because of bone-on-bone degeneration, arthritis in the knee.
Yeah.
So I could see how those patients, even if they came, might not get to 100% because they're still having these other problems.
And then we can't focus on other things, right? Because pain is just overwhelming sometimes.
Right. So if patients are interested in learning more about pelvic health or how they can help themselves, where can they go for resources?
Yeah, so honestly, if I was somebody looking for pelvic floor therapy, I would go ahead and look at local pelvic floor therapists in your area and call them, have a conversation, see how they treat the person. Does it match with how you value services? Do they feel like a good fit? And then go from there. Make sure you are very aware of the process and that you don't feel like you're left wondering, how is this going to help me? I think that's the number one thing. Start a conversation with your friends.
Right.
You know, I think women would be very surprised the number of individuals that are starting to seek out pelvic floor therapy, and they're not talking about it because, you know, it's an intimate topic. So I'm pretty sure somebody you know at some point has seen a pelvic floor therapist. So, you know, get information from them, share information. I think that is the biggest thing, is just starting the conversation with anyone, and then going from there.
You know, I really feel like the word needs to get out. I've been a practitioner for almost 30 years now, and I've learned so much just speaking to you for a couple minutes. I had no idea how you're really truly holistically looking at the whole, and your approach is you're looking at the entire being, similar to how I look at things. You know, you're looking at diet, you're looking at exercise, you're looking at past history, you're looking at injuries. I mean, it's actually pretty impressive. So yeah, I would imagine somebody would have to call and ask these questions if that's the type of care they're looking for. Is, you know, are you looking at diet? Are you looking at exercise? Are you looking at the entire body? Or are you just focused on this?
Yeah. Another great resource, you know, talk to your gynecologist or your OB. You know, they should have recommendations. Might not be the perfect match for you, at least, but you have a direction to go into. Things that pelvic floor therapists are really branching out to work with are chiropractors, midwives. You know, the word is starting to spread. So if you don't have, you know, friends or family members that you can kind of start the conversation with, reach out to your healthcare professionals. You know, they should be in tune with what's going on, and they should be able to provide you with a referral of some sort.
And do you have a national or a state organization? Are there any organizations where there's lists of pelvic floor therapists in areas, or?
So that's a little bit of a tricky answer. There are ways to find pelvic floor therapists in the area. There's different websites that have directories, but there's nothing specific to like a national list. And I, to be honest, I'm not sure of all the different directories out there. So that's kind of a hard question to answer. Sure. Google can be helpful, but again, that's gonna need a conversation. Don't just
right, no, and I
call
think,
the first one.
And I would say for me, I think a lot of it is, you know, asking people that you trust. I agree with you too. If you have a physician that you really like, another healthcare professional that you trust, you know that.
Yeah, and you know, us as healthcare professionals, once we really match well with other healthcare professionals, we trust that healthcare professional is going to take care of you in the manner that we take care of you. So, you know, it's a great way to start.
Right, thank you. Dr. Lesley, I'm thrilled that you came today and you sat down and you talked with us and you educated us about pelvic floor therapy. If patients are interested or viewers are interested in learning more about you or how to locate you or find you, tell me how they can do so.
Well, thank you so much for having this conversation with me. I think it's really important that we share our knowledge so that our patients can get what they need. If you would like to find out more about me, I do have a website. My website is www.fitpelvichealthbraidington.com. On there you can go ahead and find out more of the conditions we treat, you know, what it looks like during the first session, which is the evaluation. We talk a little bit more about the treatment plan. Obviously it's very generic, but you get a good idea of information on there, a little bit of a background on me. I do have an Instagram. It's at fitpelvichealth_Braidington. I wouldn't say I'm the best at posting things, but I do try to help and educate a little bit about our services.
All right, wonderful.